what I think is a very useful topic, and I hope that you'll get some practical information from the presentation this evening that you can start to use almost immediately in your own veterinary practices once you have a bit of a chance to think about some of the subjects that we're going to talk about this evening. So let's get started. The topic of this afternoon's or this evening's presentation is Secrets for a Feline-Friendly Practice. And this is a topic that I very much like speaking about because I think it's so important for all of us, especially now, to be thoughtful about. Now, I have two practices in Ottawa, Canada, and they are both practices that see only cats. So some people might think that it's actually easy for me to have a cat-friendly practice because I only have cats as patients. But I'll tell you that I have challenges as well trying to make my practices cat-friendly. So it's not necessarily any easier if you have a practice that sees only cats. So we'll talk about some of the challenges that all practices have in trying to make life a little bit better for cats when they have to come into the veterinary clinic or the veterinary hospital. And I always do like to start by giving an acknowledgement to the team that I work with. So here you can see some of my team members. This picture was taken about 2 weeks ago when they volunteered to help out our local animal shelter to provide some spay and neuter and some dentistry services, mostly to cats, but also to some dogs that are waiting for new homes. So these are animals that are ready for adoption. And my team is very generous, and they help out in the community whenever they can. They also are so important to my ability to practice feline medicine. So I always like to say thanks to all of the people who work with me and who stand behind me every day in my own practices, because I really couldn't do what I do without all of their help. So we're going to start off by looking at some statistics. Now, this is just an example of how we see the cat versus dog population changing over time. So the numbers that you can see on your screen represent pet cats and pet dogs. They don't take into account the thousands or even millions of stray or homeless cats and dogs that are present in some countries. So this is only looking at animals that are counted in surveys of pets in people's homes. And in the last about, let's say, 10 to 15 years, we've seen many countries, cats are becoming the more popular pet. You can see that in Canada, we have almost twice as many pet cats living in people's homes as we do pet dogs. In the United States, it's closer to being even, but there's still a few million more pet cats in people's homes than in pet dogs. And it's true in the European Union as well. So these numbers are for all of the countries in the European Union. Individual countries would be slightly different, of course. So despite these statistics, many veterinary practices see more dogs as patients than they do cats. So you would expect in a country where the majority of small animal pets are cats that veterinary practices should see at least as many cats as dogs. And really they should be seeing more cats. But this does not seem to be true. It's certainly not true in Canada, and it's not true in the US, and it's not true in many other countries where cats are the #1 pet. So we're going to look at some of the things that prevent cats from coming into veterinary practices when we really should be seeing many more of them than we do now. So there are a lot of reasons why in the last number of years we're talking about this concept of being cat friendly or being feline friendly. Of course, it means that there's millions of cats in every country that don't get any veterinary care at all. So it's certainly a health and welfare issue for those cats. They deserve veterinary care just as much as any other pet. We also would like to improve some things on the veterinary side. So in many veterinary practices, they have less experience dealing with cats, and many people who work in veterinary practices might feel less confident. They might be more concerned about being injured. So we'd like to improve people's confidence in working with cats, improve our job satisfaction, and we'd like to decrease the stress of the whole experience, not just for those of us on our veterinary team, but we'll talk about the stress for the owner, and we will talk about the stress for the cat as well. So certainly if we can start to do a better job with cats as patients, the other benefit will be an improvement to our business. And an ability to build your reputation in a new area or a little different area of veterinary medicine by building your skills and your expertise in feline medicine. So there's a number of reasons why this is an important topic. So we're going to go through a few areas in our agenda today. We'll really start thinking about this whole concept from almost from the beginning when the owner first makes the decision to go into the veterinary clinic. So we'll talk about that. We'll talk about cat carriers. Even though we're veterinarians and we're concerned about medical issues, if we don't think about things like cat carriers, we'll never get cats inside our practices as patients. And then we'll kind of go through the different areas of a veterinary practice, like the reception area, the examination or consultation room, what happens if a cat has to come into the hospital, and we'll look at some of the things that we can do in each of those areas to make our practices more feline friendly. And then we'll also be looking at a variety of different resources that you can find online that are available for free to help you learn even more or gain some greater skills in some of these particular areas. So we're going to start thinking about this even before the cat comes into your practice. Most of us, when we think about the cat's veterinary visit to the practice, we just think about the time period that the cat is actually in our building. But in reality, the veterinary visit is much longer than that for the cat and for the owner. So it starts at home even when the owner first has the thought that they're going to bring the cat into the veterinarian. Then, of course, they have to find the cat. They have to get the cat into a carrier, which we'll be talking about. They have to travel to the veterinary practice. So that could take 30 minutes, 45 minutes, maybe even more, depending on how easy it is to catch the cat and how far away they live from your practice. Then they'll of course spend some time in your practice. That might be a short amount of time. It might be a longer amount of time. Partly that depends on your style of practice. And one of the things that we'll talk about is pre-booking appointments for cats and how important that is when it's possible to do that. But even once the veterinary visit is over, the whole experience of the visit isn't finished for the owner. There's still the trip back home and then integrating the cat back into the home environment. So we must always remember that once the cat gets back to its home, it may not act normally. It may be still scared. It may hide. It might run away. There might be conflict with other cats that live in the home or live in the neighborhood. So for the owner, that experience of the veterinary visit lasts even longer than the period of time that they spend actually in our building. So we really need to think about that whole experience in order to understand what's happening with the owner and what's happening with the cat. This is some data from a survey that was done of cat owners in the United States. And I suspect that the results would be pretty similar in most countries in the world. And in that survey, they talked to cat owners about their experiences in coming into the veterinary practice. And more than 1/3 of those cat owners said they start getting stressed when they just think about visiting the veterinarian. The day hasn't even come. They may not even have made a pre-booked appointment. It's just the initial thought about coming in to the veterinary practice starts getting about 1/3 or more of cat owners already nervous and stressed. And then, of course, as the day approaches and they must actually bring the cat into the veterinary practice, then that stress level, that percentage of people who are stressed, increases. So a lot of what we're going to talk about are things that can help decrease that stress component, both for the cat and for the owner. And the reason that's important, of course, is that if the owner has an unpleasant experience or the cat has an unpleasant experience, they are not very willing to come back and see us again. They're not willing to become regular clients or regular patients of our practice, which is what we need in order to provide good ongoing care for these cats. So the first thing that we'll talk about are what I call the 3 rules of cat carriers, because the cat carrier itself is often an important reason why people struggle to bring their cat into the veterinary practice and why sometimes the cat and the owner has a bad experience. So the first rule, of course, is a bit of a common sense rule, I think, and that's that cats should come to your veterinary practice in a cat carrier. They shouldn't come in a laundry basket, um, in a beer box, in any other kind of box, in a sack. I'm sure, just like me, you've seen cats arrive at your veterinary practice in all kinds of different things, or sometimes just in the owner's arms. And we have to educate owners about why this is a bad idea. There's, of course, a risk that the cat will escape. The cat could get lost. There's a risk that the owner will get injured. There's a risk that the cat will get injured. So the whole experience of being at the veterinary practice may get quite difficult and quite unpleasant even before the cat gets into the examination room or before they even see the veterinarian, if the cat carrier or the lack of a cat carrier is part of the problem. This is one of my patients. This is a lovely Bengal cat, a little female cat named Maya. And Maya's owner has trained her to walk on a harness and a leash. So Maya lives in Ottawa. We are a city of less than 1 million people. Some of the cats that are my patients live totally indoor lives because they live in high-rise apartment buildings. But some of my other patients also have access to outdoors. So Maya lives totally indoors, but her owner has trained her to walk on the harness and leash so that they can take her outdoors safely. And that's a great idea. So it's good for the cat. It gives her some enrichment to her life, but it's not a good way to come into the veterinary practice. Maya doesn't feel as safe or secure as if she was in a cat carrier. She could get frightened by another cat who's also in the waiting area of my practice, and certainly she could get injured, or the owner could get injured if Maya gets frightened, because the cat's first instinct when they become frightened is to try to escape. So we talked to Maya's owner and explained this, and Maya now comes to us in a cat carrier. Rule number 2 is that there are good cat carriers, but there's also bad cat carriers. So we need to educate owners so they know what a good cat carrier is and why it's important that they use a good cat carrier. So the one that you can see in the picture here is a very old cat carrier. It's a type that we used to see very commonly maybe about 20 years ago. So it's made just of wire. And the problem, of course, is that the cat feels very exposed. The cat has no place to hide. And also the door on this carrier is very narrow. So it's quite difficult to get the cat in and out of the carrier. And the cat could get injured on the wire, on a piece of wire, if it breaks off over time. So there are a lot of these older carriers that actually are not very safe for cats to be in. One of the best style of cat carrier is this kind because they're easy to find. They're usually the least expensive type of cat carrier. They're usually made of a sturdy plastic, but what I like about them is that there are the fasteners, or the snaps that go around the edge of the carrier make it easy to unhook all of those fasteners and very quickly remove the top of the cat carrier. So I really like cat carriers where the entire top can be removed. It's easier to get the cat in and out of the carrier, and you'll also see that it allows us to examine some cats while they're still in the carrier in some cases. So in our practice, we actually keep some of these carriers for sale to owners who come in and they don't have a good cat carrier. We keep some inexpensive ones that have these removable tops so that the owner can make the decision, hopefully, to buy one while they're at the clinic, and we can put the cat immediately into a safe carrier. We also keep a few of these carriers that belong to our practice. So if an owner comes in the door with the cat maybe in their arms or in an unsafe box, we'll offer to move the cat into one of our own cat carriers and allow the cat and the owner to use it temporarily, because we're very, very concerned about everybody's safety when the cat comes into the practice. So I'll just quickly show you a few other kinds of cat carriers, because there are so many different ones on the market now that there should be one that would appeal to just about every cat owner. They're different shapes and colors and sizes. This is another one where the entire top of the carrier opens, but also the front door on this carrier is very big. So when it's open, it makes it much easier to get the cat in and out of the carrier. So I do like carriers where there's more than one way to get the cat in and out. That's another benefit. This is a smaller, lighter weight carrier that's easier, especially for older people, because the carrier itself doesn't weigh very much, but the front of it unzips so that that entire side opens up, making it easy to get the cat in and out of the carrier. This is another style that is heavier. The drawback to some of these carriers is that they're made of very sturdy material, but it can make them too heavy for some people to carry, especially if the cat itself weighs a lot. But both sides of this carrier open up completely. So again, it makes it very easy to get the cat in and out of the carrier. And yet another style where again we can see that the top fully opens and also a front door opens. So I do like these ones where we have more than one way. This is a lighter weight carrier because it's made of a fabric instead of plastic. So there's lots of versions of these carriers on the market, and really clients now should be able to find something that they like. We just need to educate them about a few of the key things that make a cat carrier safe and easy for us to work with. So rule number 1 is the cat should come in a carrier. Rule number 2 is we want to make sure it is the best kind of carrier, preferably with a removable top of some kind or a very wide opening on the front or on the side. And rule number 3 is that if a owner is bringing more than one cat at a time into your practice, there should be a carrier for each cat. So it's very tempting to put 2 or more cats into a bigger carrier. The problem is, though, that the stress of coming into the veterinary practice and spending time with us increases the anxiety levels of these cats. And when we then try to put them back into the carriers, probably you've all seen this happen at least once, then the cats are not so happy and they may even be fighting when we try to put them back into the carriers. And then that can lead to these cats continuing to fight at home for the next couple of days. And whenever a cat doesn't have normal behavior at home after a veterinary visit, like fighting or running away or hiding, that upsets the owner. And it's one of the things that makes them less willing to bring their cats back to see us. So that's another key education point that we need to tell owners, is that they should have one carrier for each cat that's coming in to the practice. So these are ideally resources and education points that we should provide to owners before they come to the clinic, and you can do that through your website if you do that. If you have a Facebook page, you can provide this type of information on your Facebook page, show examples of good cat carriers to help educate owners. And there are a number of online resources as well. So International Cat Care at icatcare.org has a very nice section for owners that includes some information on cat carriers and what makes a good cat carrier. And they also have a brochure. I think it might only be in English, so you should check the website and see if they have translated it into other languages. International Cat Care does try to translate into various languages most of their materials. So they have a very nice one called Getting Your Cat to the Veterinarian. So we need to try to reach out to owners in as many ways as we can. If you use a newsletter, if you write a blog, if you use Facebook, anything like that, where you can reach out to your cat owners in advance and help educate them about what makes a good cat carrier. All of these things help. It's also important that they understand that all of these resources can give them a number of different tips and tricks too. So one example is making sure that the cat carrier is a reasonably friendly or happy place. So this is a picture I took at the home of one of my friends where he leaves his cat carrier out in a corner of the living room in his house, and one of his cats actually eats its meals in this cat carrier. So for that cat, that cat carrier is not a scary place. It means something good. It means it's mealtime, or it means it's a resting place, or maybe a place where the cat gets treats. So that's just an example of some of the tips and tricks that some of these resources make available to your owners that can help them before they bring the cat into your practice. And also, all of your veterinary team members should know some of these basic pieces of information about carriers too. So when they're talking to cat owners on the phone, they know what to tell cat owners. So they know what to say, they know what kind of advice to give. It's also a good idea to consider doing a phone call a day or two after the veterinary visit, maybe especially for a brand new client, or maybe a visit where there was some stress with the cat. A phone call a day or two later made by one of your staff can find out if the owner is still having problems with the cat at home, and is there something that we can do, is there some advice that we can give, because many people will have problems after they take the cat home, but they won't call and tell us. And I already mentioned having a couple of cat carriers that belong to your practice that you can loan to owners temporarily until they get a good one of their own, and then again using some of these online brochures and some of these videos with our owners. So we can't underestimate what happens in the home environment. If an owner has more than one cat, the other cats at home may not react as well to the cat that comes back from the veterinary practice, even if they were all very friendly and got along well initially. So the cat that comes back from the veterinary practice might be behaving a little differently because it's stressed or nervous. It might bring different smells or odors home from the practice. And so it's important to talk to owners and find out if this has happened before and what can we do to prevent this disruption in harmony. And often the easiest thing is just to keep the cat that is coming back from the veterinary practice in a separate room for an hour or two before they reunite with the other cats in the home. Just a short period of separation once the cat arrives home is often enough time to allow everybody to calm down and for behavior to return to normal. So once the cat is in the carrier and they arrive at your veterinary practice, let's talk about the reception area or the waiting area of your practice. This really is where first impressions are made. And this picture is a picture that I took in a waiting area of a veterinary practice that I think illustrates something that happens very often. So that reception desk or the reception area is often a very rather risky area for cats and cat owners, because as you can see in this picture, here's a cat in a carrier trying to hide, and the dog has just noticed that there's a cat in the carrier. And as I was standing watching, the dog ran over to the carrier, and because the dog was curious, he just wanted to see the cat, but it really upset that cat. And that cat became, hissing and growling. And then, of course, by the time the veterinarian was ready to examine the cat, that poor cat was already very stressed simply because of this meeting at the reception desk with the dog. And there's a very easy way to solve that. And the way we do that is getting cat carriers up off the floor. So in this case, the reception staff simply needed to ask that owner to put the cat carrier up on top of the reception counter so that it wasn't at floor level or at dog level. So we need a way within our practices to keep cats above dog level in that common waiting area. Of course, if it's possible, it's even better to consider a separate waiting area for cats, or just a separate section of your existing waiting area. This is this picture and the next one are pictures that I took in a very small veterinary clinic in Tokyo, in Japan, where veterinary clinics sometimes are very small because real estate is expensive. Even in this really tiny veterinary clinic with a very small reception area, they designated one end of the reception area for cats and the other end of the reception area for dogs. So this is a picture of the reception area for cats, and you can see that even though it's small, they still provided some tables to allow the cat carrier to be up off the floor. And in fact, the higher the cat carriers can be, the higher they are above dog level, that's even better. So tables, shelves, benches, anything that will get the carriers above dog level. They also provided these nice little red and blue blankets to cover over those cat carriers where the cat feels very exposed, so that the cat has that ability to hide and feel a little bit safer within the cat carrier. So even in very small reception areas, it's still possible to get cats off of the floor level, to cover the carriers over, and even to designate one area that's just for cats. Here's another veterinary practice that installed benches in the middle of their reception area so that dogs and dog owners wait on one side and cats and cat owners wait on the other side. So often we can use some very simple solutions rather than thinking about entirely renovating your reception area. This is a very interesting idea from a veterinary hospital in Australia, where they actually built this little modular section within their waiting area and called it their cat-friendly waiting area. So you can see that they put a few chairs inside this section, and the chairs are facing the shelves where the owner can put the cat carrier up on the shelf, again, up off the floor, and the dividers mean that each cat cannot see the cat carrier that would be next to it. So I thought that was a very smart and interesting way to designate a separate cat area. And here's just one more example for you. This is a veterinary practice that had one corner of their reception area that seemed to be easy to make into a cat-only waiting area. So they simply installed or bought a screen and put a screen there. And on the screen is a little sign, and that little sign says cat waiting area. No dogs, please. So it allows the cats and their owners to wait behind the screen in an area that's separate from where dogs and where dog owners wait. So there's any number of ways to think about separating cats and dogs in your reception area. This is one of my veterinary clinics. You can see we use a lot of chairs. Of course, we don't have dogs, so I don't have to worry about the cats being up above dog level, but I still know that they feel better if they're not on the floor. And another example of a cat carrier that's leaves the cat feeling very exposed. So our reception staff keep a stack of clean towels right at the reception desk, and they offer a towel to the owner when the cat comes in the door in a carrier like this, so that the carrier can be covered over and the cat can feel less exposed. Another idea that's becoming more popular as a way to separate cats and dogs is to consider designating maybe one afternoon a week, or it could be one day a month, but some time period during your operating hours where you invite only cat owners to come with their cats. Of course, if a dog is very sick or has an emergency, they would come as usual. But you would use that time for pre-booked appointments for routine visits, vaccination visits, reevaluation visits, and so on, just for cats and their owners. This is proving to be a very popular idea where many owners like knowing that there won't be any dogs. And also, you may find that there are people working on your team. Some do better with cats than others. So that could be a time when your best cat expert team members could be working, and that's also very attractive to cat owners. So let's talk a little bit about the consultation or the examination room. In hospitals that have more than one examination room, so they have multiple examination rooms, one possibility is to designate one of those examination rooms as a room that's meant only for cats. So you can see the sign on the door of an examination room in a large hospital that I visited, where they were able to set one of those rooms aside, knowing that only cats would be examined in that room. That way there's no dog smells. All of the equipment that's in the room is specific to cats. It makes it much easier to work with cats if you're able to do that. But if you're not, there's still lots of things you can do in an examination room to make it friendlier to cats. I'm going to show you some examples of having a non-slip surface on your examination table so that cats feel more secure. It's important that the room not be cold. So it doesn't have to be too warm as long as it's comfortable for the people who are working there. But we don't want it to be too cold because cats, as probably most of you know, prefer warm areas. You also want to be sure that all of the equipment or the supplies that you're going to need are in the room. So you don't have to leave the room and come back in. The less traffic in and out of the examination room, the fewer people in that room, the calmer it is, and the less stress, the less anxiety cats will feel. We also recommend that you use Fellaway. This is one of my examination rooms with the plug-in Fellaway diffuser. There's an article that came out in the Journal of Feline Medicine and Surgery just less than a year ago, a project that was done to determine if Fellaway reduced the stress of the veterinary visit, and it turns out that indeed it does seem to lower the stress scores and the anxiety levels of cats if we have Fellaway either used as a spray or a diffuser, as in this picture, in your consultation room. So there's typically a number of little things we can do to make that consultation room be a little bit less stressful and friendlier to cats. We're going to look at a few ways to make the examination table feel a little bit more secure. This is a photo I took in a clinic where they use a changing pad, a diaper changing pad for babies. So you can see the surface is a little bit curved, and the cover of that pad comes off and can be washed. So they just keep a stock of covers for this changing pad, and after every cat is finished being examined, they take the old cover off, put it in the laundry, and put a new cover on. So it allows them to have a nice, warm, very friendly surface to examine cats on. Of course, if the patient if you're concerned about infectious disease or the patient has diarrhea, then we would want to use an impermeable surface. But if those aren't issues, then it's worthwhile looking at these different ways to have a more inviting, friendlier surface. This is another way. This is a stainless steel examination table that has a bathroom mat. This is a mat with a non-skid surface on the back of it. So it doesn't move around when it's on the table, and cats like that warmer surface. They feel secure. Often they feel more relaxed, so it can make the examination process easier for everybody. You can also see in that picture that there's a very small scale with a basket used to weigh cats. You always want to weigh the cat in the consultation room. We don't want to move the cat to different areas of the practice to get different things done if we can avoid it. And all of the supplies that the veterinarian needs are very close at hand. So once you go into the examination room with the cat, you don't want to have to leave it if possible. So that's a good illustration, this picture of all of those principles. Once we do have the cat ready to be examined, I usually open the carrier door and wait and see if the cat will come out on its own. So during that time, I will get a medical history from the owner. I'll talk about their concerns, what they've noticed with their cat, why did they bring the cat, and I'll ignore the cat. And especially younger cats, they'll often get curious about what's going on, and if I leave the door open, they'll simply come out on their own. So it's always best to see if the cat will come out on its own. But if it doesn't, that's where one of these carriers with a removable or openable top is really helpful, because then instead of forcing the cat through the door, we can simply open the top, or as you can see in one of the pictures, if the cat is very fearful, maybe it's hissing or growling, we can put a towel over the cat after we remove the top to make it safer for everybody to work with that patient. This is a series of pictures to show you how to get a cat out of a carrier when the cat is very, very fearful and feeling defensive, and you're concerned that you might get bitten or you might get scratched. So we start by placing the carrier on the floor with the door up against a wall. Then we make sure that the fasteners holding the top of the carrier onto the bottom are loosened. In this case, it's an older type with screws, so we loosen those. Whatever the fasteners are, we loosen the fasteners. And that allows the door in most carriers to come free, and so we allow the door to become loose from the top and the bottom, but we don't want it to fall on the floor, so that's why the carrier is up against the wall, so the cat can't escape through that opening once the door is released. Then you have an assistant lift the top of the carrier up slightly, and you slide a towel underneath, so in between the top and the bottom. We're trying to prevent the cat from escaping, and then we're going to quickly scoop the cat up in the towel so that the cat is covered and we have the towel as protection. So there's lots of techniques using towels that enable you to work more safely with these very scared and defensive cats. So we often examine cats that are very nervous when they're bundled up in a towel in one way or another. It allows us to leave the maybe the head of the cat free to be examined, or then you could cover the head and move to the rear end of the cat. You can get your stethoscope underneath the towel. So there's lots of ways to use towels, or you can even see a basket or a box being used, anything that allows the cat to feel like it's being able to hide a little bit or feel a little bit more secure. Especially with young patients, we like to distract them with food or with toys. Young patients are usually easy to work with, but I want to build good memories. I want them to remember good things at the veterinary practice. And I want the owner also to see that I'm thoughtful about their cat's experience and that I'm trying to make it a happier visit for the cat. So I ask the owner's permission, and then we usually keep different kinds of treats or food in the examination room to tempt the cat with. Here's a couple of little kittens. Kittens often will eat canned food very easily in your examination room, or you can keep toys. I keep some very inexpensive toys in the examination room, and then especially if it's a new owner who's bringing a young kitten to us, we'll give them that toy for free. It costs me very little to do that, and yet it may be an investment in a patient that will be with me for the rest of that patient's life. So it can be a very good investment to give a small thing like an inexpensive cat toy. Even adult cats will often play with toys. This is a patient of mine named Mischief, and Mischief had an adrenal problem, an adrenal tumor actually, that he needed treatment for. So he had a lot of veterinary visits, and we found that he was a cat who liked catnip, and once we started offering him some catnip toys to play with, he became a much easier and happier cat to examine and to get blood samples from, because he needed a lot of veterinary visits in a short period of time because of his disease. So kittens are often easier to give toys and food to, but adult cats, it can work with many of them as well. It also helps to be flexible about where you examine the cat. So not all cats feel secure on top of a table. Sometimes I sit on the floor. Cats might feel better sitting on your lap, on the floor, or again, you've already seen that it's a good idea to use baskets, especially if there's no infectious disease or diarrhea, and it's a surface that you can disinfect. or to use boxes of some kind. These often make cats feel a little safer and a little secure while we're actually doing the physical exam with them. A couple of other examples. On the right-hand side, you can see another example of using the bottom of the cat carrier. So again, for nervous or fearful cats, we'll just take the top off of the carrier. We won't make them come out of what is a place that's a little bit more familiar to them, and we'll do the examination in the bottom of the carrier. The other picture is of a consultation room that has a window with a window ledge, and sometimes cats like to jump up on places like that and be examined. So we sometimes just have to be flexible and examine the cat where it feels most comfortable, even if that's not on our examination table. One of the really important things in working with cats is to allow enough time. So ideally, we should have pre-booked appointments, especially for routine care for cats and scheduled reevaluations. And ideally, they should allow 20 minutes minimum. In some cases, 30 minutes is even better. So especially for kitten visits, because there's so many things to talk about with a new kitten and a new cat owner, or with an elderly cat that might have more medical problems. So scheduling visits in advance whenever possible and allowing enough time for them, I think, is even more important than for cats than for dogs. Cat examinations, cat veterinary visits take longer typically than they do for a dog. And the less time the cat has to spend waiting in your reception area, the better. So that's why pre-booked visits are often more beneficial for the cat necessarily than for the dog. So we've already talked about some cats that can become aggressive, and there's really two main reasons why cats become defensive or aggressive in the veterinary clinic. And I think the number one reason is simply fear. They're very afraid of leaving their home. They're very afraid of a new environment and new people. Their first instinct is to escape, but we are preventing them from escaping. So then they become aggressive or defensive. And the other reason, of course, is pain. And many of our patients are feeling fear and pain at the same time. So I think it's important to recognize that these cats are not mean. They're not out to get us. They don't hate us. They're fearful. They think they're going to get injured or die, or they're very painful. So if we understand the reasons, then we can adapt our approach to these cats to be more effective. It is important to learn handling techniques so you don't have to scruff cats or hold cats by the scruff of the neck any longer. This is a picture of a young cat in a veterinary hospital. This cat had a urinary blockage, so it's been very sick, it's been very painful, and now a veterinarian is holding it by the scruff of the neck in order to examine it. And you can see just from the look on the cat's face how scared it is. That cat doesn't know what's going to happen. And of course, that just makes the situation worse when we make a patient fearful that they might get injured or they might be harmed in some way. So whenever we do have these anxious, defensive, aggressive cats, I think it's important to try to recognize the early signs. So the body postures, the beginnings of hissing or growling, stay calm yourself, and try to avoid escalating your restraint, because as you get more aggressive with restraint, typically cats will respond with even more aggression on their part, because then they become even more convinced that they're going to be harmed. So we use a lot of towels and blankets in our practice to cover cats, to restrain cats. We don't use gloves. We very rarely use muzzles. We don't use nets. We primarily use towels. They're kinder. There are some excellent techniques for towel restraints, and they allow the cat to hide, so they're more humane. Here's just a couple of pictures showing you ways that cats can be wrapped up in a towel, and yet you can expose the parts of the cat that you need to examine, whether it's looking in the ears or palpating the neck or getting a stethoscope underneath the towel or the blanket to listen to the heart or the lungs. You can get your hands underneath the towel to palpate the abdomen and so on. So we work with these cats very slowly and very calmly, and we work with them underneath the towel. But there always will be cats that using techniques of like towel restraints won't be enough. And so I can recommend a couple of drugs to you that have been useful in working with these cats. Both trazodone and gabapentin at the doses that you can see on the screen have been evaluated and shown to be effective. These are drugs that you would provide the owner to give the cat at home before they come into the veterinary practice. So trazodone can be given 1 to 2 hours before the visit to the practice. Gabapentin should be given 2 to 4 hours before. These drugs don't cause a lot of sedation. Actually, the sedation is pretty minimal. Mostly what they do is relieve a lot of the stress and the anxiety, and they can make these fearful cats much easier to work with. When they're already at your veterinary practice, maybe they haven't had any medication at home, or maybe they need more. There are, of course, lots of drugs you can give at the veterinary practice, but two that we most commonly use would be butorphanol, easy to give by intramuscular or sub-Q injection, has a little bit more sedative effect than buprenorphine. Buprenorphine has more pain-relieving effect. So often for the older cat that might be sick and painful as well as scared, we might use buprenorphine. And you can combine these drugs. So for example, a cat that could get gabapentin at home and then some butorphanol or some buprenorphine when it arrives at the clinic. So you would adjust your drug protocol to whatever that cat needs. But they are great ways to reduce the stress. We never fight with cats in our practice. So if our towel techniques and our handling techniques aren't enough, we always use drugs to reduce the stress and facilitate the examination or drawing blood or taking x-rays, whatever it is that we need to get done for that cat. And I've already mentioned that in many practices there are people that just have better abilities to work with cats, and so we want to encourage that. We want to help these members develop their cat expertise, show them where they can learn more, send them for training, and so on. So we need to leverage these people. We need to use their expertise and help them grow in their abilities, like learning better handling techniques, for example. In our practice, we also offer house call services. Many cats are better to have an examination at home. So especially for simple things like getting vaccinations or getting deworming, or for some simple follow-ups, one option is to provide some house call services. Often works very, very well for cats that have difficulty coming into your practice. So I'm going to spend the last few minutes talking about cats that have to come and stay in your clinic, whether it's just for part of a day or maybe you have a hospital where you're able to keep cats for a longer period of time, maybe overnight or something like that in your hospital. So unfortunately, we do see a lot of very fearful and stressed cats, like the two that you can see in these pictures. Is a very common sight in veterinary clinics, and these are pictures of cats I took in my own practice. So as I mentioned at the beginning, I have just as many struggles trying to make my hospitals less stressful for cats as everybody else does. So there are a lot of things that are stressors to cats in our veterinary hospitals. It's an unfamiliar place. There's noises and smells that are new. There's unfamiliar food. There's people they never met before. There's a lot of other animals. And they don't have the ability to escape or to hide, which is really what they want to do. So we can address some of these things. We can improve some of these stressors for cats. And we want to do it because we want cats to have more normal behavior. That helps us get a better evaluation of their medical condition. If they have to stay in the hospital for a while, we want them to be able to rest and to sleep. And some cats will even have physical symptoms like vomiting or diarrhea or just no elimination at all or not even eating due to the stress of the hospital. So we would like to change those things. So we do want the cat to feel more safe and secure. We want less stress for everybody. I always emphasize that we want our own team members, we want to be safe. We don't want to get bites. We don't want to get scratched. And we want cats to recover successfully. So there's a lot of reasons to make that hospitalization experience a better one. Whenever possible, we'd like to keep sick cats away from sick dogs. So trying to keep cat cages at least as far apart as we can from dog cages, the better, because a sick cat is already feeling very stressed, and then especially if they have a barking dog or a vocalizing dog near them, that can make their recovery even harder because of the stress. Cages that make a cat feel very exposed, like these cages. These are hospital cages in a clinic that I visited a few years ago, and you can see they provide no way for the cat to hide, so it makes the cat feel very stressful. If it's possible to have a completely separate hospital area for cats that's different from the area for dogs, then that's a great idea. That is the best solution of all. We can't always do that, but if we can, that's probably the best solution within the hospital. When we do have cages, we'd avoid having cats facing each other from one cage to another. So ideally, we wouldn't have cages across from each other like this because cats would not like seeing another cat on the other side of the room. So in a situation like this, we would want to cover part of the door with a towel so the cat could hide and not see the other cats. And in fact, really what cats want in their cage is the ability to hide. That's why this cat has made a big mess of its cage. It's tried to make a place to hide so that it feels more secure inside its cage. That's also why you see cats often in their litter pan in the hospital cage. They might sleep in it or hide in it, and it's because we need to provide them with a place to hide. So there are newer types of caging for cats now that provide shelves. They're a little bit bigger. Some of them have these portholes that make two cages into one big cage, and then you could close that porthole if you needed to return it to two individual cages. So especially if you're building a new clinic or you're renovating, you can look for some much better caging than used to be available in the past. Providing a hiding place can be done for any kind of cage, whether it's a type of hiding cat bed that the owner can bring from home, or if the cage is big enough, the cat's own carrier can go inside for the cat to hide in. We can also just save cardboard boxes. That provides both a hiding place and it acts almost like a shelf. So the cat could sit on top if it wanted as well, and then we just throw the cardboard box away after that cat has gone home. We also want to make sure that the food and water are not right next to the litter tray. Even in a small cage, we would like them at opposite sides of the cage to encourage the cat to eat and drink and also to use the litter tray. And to try to have a litter tray that's big enough depending on the size of the cat. Sometimes we provide ones that are way too small for the size of the cat that's in the cage. I'd also encourage you to think about using products and equipment that are cat friendly. The International Society of Feline Medicine, through their website at icatcare.org carries a list both of cat-friendly drugs and also cat-friendly products that I consult whenever I'm thinking of getting a new drug in my practice, or I need some new equipment, or I need a new product. I always go to their website and I look for their cat-friendly equipment and product list. And then they also have what they call the easy to give section, and this is for different drugs and medications for cats. So I'd encourage you to have a look at those, because they provide us with advice on things that make it easier to get medications into cats and products that are easier to use. And just a couple of examples of that would be an Elizabethan collar that's soft instead of being made of rigid plastic. This is an example of a cat-friendly product because the collar is soft. It allows the cat to rest better. The cat can eat better with a collar like that. Here's another example. We use a lot of feeding tubes in sick cats in our practice, and instead of bandaging the esophagostomy feeding tube, there's a product called a kitty collar that goes on the cat's neck with Velcro. So it's washable. So it's very easy for the owner to maintain and change that, because often these cats have feeding tubes in. For example, a cat with fatty liver disease might need a feeding tube for weeks or months, and it makes it much easier for the owner to manage that at home. So there are a lot of resources that make life easier for cats and for owners. And of course, you might be aware of the Cat-Friendly Clinic program through the International Society of Feline Medicine. You can access the information on the program itself through icatcare.org. If you're an ISFM member, of course, you can access it through your membership. But even if you're not a member, they still provide quite a few pieces of material, information on how to make your clinic more cat-friendly that are free of charge. So even if you're not a member, please go have a look at the icatcare.org website for some of the things that will help you become more cat-friendly, and then consider looking at their cat-friendly clinic program, where you can get a designation as a cat-friendly clinic that you can then use in your outreach to cat owners to try to increase your feline business. So there are some robust and very detailed programs available now to support you and help you as you try to make the experience for cats better within your own practice. So I'm just going to finish up with a couple of things that I hope that you can think about starting with maybe today or probably tomorrow, because it's already in the evening. So some things are very easy to start with. So for example, you can think about your reception area, and is there a way that I can put a table or a shelf to get cat carriers off the floor? Can I have towels or blankets to cover cat carriers ready at your reception desk? Those are often easy things to start with. Start with thinking about how you'll educate owners about cat carriers. Maybe on your Facebook page, maybe with some brochures that you can give to owners in your waiting area. Make sure that your reception staff have the key information about cat carriers so that they can talk to owners themselves. Think about how you can put a hiding box, even if it's just a cardboard box, in your cat cages, even if a cat is just staying in your hospital for the day, and certainly if they're going to stay in your hospital for a longer period of time. And think about making a phone call after visits, especially every visit from a new cat owner, a new client. It's a good idea to make a phone call a day or two later and see how did things go. Was everything okay at home? Did they have any problems that you can give them immediately some advice about how to solve? Because we'd like to find out about these problems quicker and solve them so that the owner will feel comfortable coming back and becoming a long-time client and bringing their cat back to us for a lifetime of medical care. That's good for the cat, And that's good for us, of course. It helps increase our business. So some of the pictures that you saw were courtesy of some of my colleagues. So I do like to give thanks to my colleagues who have helped share with me, share some of their images and some of their ideas. So my thanks go to them. And my thanks, of course, go to you for listening in this evening with me. This is my contact information. I'm always happy to follow up with you if you have questions or